Hey guys, welcome to Evolving Waves. Super excited to have episode 3 today with Mr. Frank Wells. So, for those that are new to our show, our focus is on riding the tides of adversity to the shores of success, focusing in on the lessons that we go through that adversity. Uh, the person that is joining us today, I've known for quite some time now here in Charleston. He's everywhere. If for those that are watching on video, you'll notice he is decked out in purple. This guy is a definition of personal branding and is everywhere. He's like omnipresent at networking events. Um, the true ambassador of his brand and does a great job with promotion. So I'm super excited to have his story and welcome in here in just a second. We've got, for those that aren't aware, our podcast is brought to you by Stingray Branding. We're a local marketing agency here in Charleston that serves the entire country. So if you're looking for web design, social media, podcast recording, or anything else for your marketing, we're happy to help you. StingrayBranding.com. Frank,
Yes,
welcome.
thank you.
Thanks for being here, bud. I'm looking forward to this. This has been we've had lots of conversations over the last couple of years, networking and stuff. I know a little bit about the story, but I am super excited to get to dive in and learn a little bit more. I mean, you've got a great successful business, right? You've done a lot and grown that a lot over the last just couple of years, really, right?
Yes.
Fantastic. Well, let's kind of start off with the background, right? If you wouldn't mind, kind of
Sure.
let's know who you are, what you're doing today, and where it all started.
Yeah. Uh, Grew up in Charleston, so mom still lives in the same house where I grew up, which is super cool. College of Charleston, went off to New York, did was a bond trader, and then grad school, Chapel Hill, and then did consulting with Coopers and Lybrand. So I was working with companies that were in trouble financially, troubled companies, and helping them do turnarounds. Um, did that for quite some time. Worked for the Olympics, had 2,300 staff in the Olympic Village during the 96 Atlanta Olympic Games, software business, more consulting. And then in late '06, early '07, ran into Dr. Bo Machado. He was growing the HealthFirst urgent primary care clinics. He was getting ready to lose his third CEO in about 2.5 years. So it was a little bit of a struggle for him. I was his fourth CEO and stayed for 12. And the challenges that people had expressed made us a perfect fit. He was super amazing at efficiency and the medicine and taking great care of people and making sure they didn't wait. And I was good with the people, with our employees and staff and the marketing and financial strategy and other stuff. So we were really a tremendous complement for each other in this space of building. So he wasn't a turnaround, right, from my history of doing consulting, but it was a growth story. And those same principles that you use in growing a business are the same and used in turning around a business. So we just implemented those principles and grew a really cool brand in the Charleston area with multiple clinics and seeing 150,000 patient visits a year. Um, Having people walk in with no appointment, and the average wait time is 7 minutes because the doctors didn't type in computers, and we had scribes. And so the scribes did the data entry work, and while it left the doctors to be able to do the evaluation, diagnosis, and treatment of the patients, which is why people don't wait. So that was HealthFirst. I was there 12 years. We did all kinds of things in the primary care, urgent care, weight loss, occupational medicine, taking care of our company's employees. We did not have a subscription model. We took every insurance plan known to man. We filed insurance claims to 640 insurance plans, right? Some multiple Blue Cross and Aetna, Cigna, United healthcare plans, and just took everything and got paid mostly by copay by the patient, and then the insurance company almost paid the rest of the bill. This was before 2014, where you paid your premium every month, and the insurance company, after your copay, almost paid the whole rest of the bill. And literally, we wrote off the other portion of the bill because it was a small percentage and would cost more to collect it than it was to actually get the funds. So that was up until a certain point in 2014. The abuse, the challenges, the overcharges of the insurance company, and you now paid your copay as a patient. You're still paying monthly premiums to the insurance company. You paid your copay, and then all of a sudden you got a bill, a month or two later from the doctor, and it was not because of the doctor; it was because of the insurance company was no longer paying the rest of the bill until the patient met their deductible. And the dirty little secret in the insurance industry is this: is that 19 out of 20 people who have insurance never meet their deductible. So there's only one out of the 20 people that ever meet it, but then the insurance company starts paying. Right? The example would be you go to the hospital, you have a $50,000 bill, and you paid your three, four, five, $6,000 deductible, and the insurance company might pay the rest of it. And they might pay most of the rest, and you might still have some co-insurance, but they will pay the rest. So that's the 1 out of 20 that really go in the hospital. Um,
Wow.
so that ability to be able to get paid by an insurance company worked really great up until 2014. So for the last decade now, it hasn't worked well for the patient. It still worked well for the insurance company because they shifted their out-of-pocket expenses back to the patient for those doctor visits, and still got the insurance premiums that they get every month, while they're increasing every month. So it's been a real shift in expenses back on the patient. And that's kind of the reason we created Holy City Medical, because um, if the patient's going to bear that cost, why don't we cut out the cost of the insurance company filing and contracting and credentialing all the providers, and collections and billing and audits and all the craziness that comes with the insurance plans. If we eliminate that cost, then we can make it super affordable for the patient to get care and give them same day access. So we kind of did that. I don't know if I've gone too far. That's the Holy City, the HealthFirst brand that we sold 5.5 years ago, primarily because the insurance companies were doing different things than they used to do, and the patient's burden became too much.
That makes sense.
Yeah.
So let's kind of go back to the transition, right,
Mhm.
from Health First to Holy City. What led up to the exit of Health First, and why did that happen? Um,
That's
right,
a cool
and
story.
yeah,
So a few years before we sold, one insurance company reached into our payroll account, bank account, where we would receive payments from them. In the contract, all of the doctors pretty much signed that you file a claim, you see a patient, file a claim, the insurance company puts money in your account. That contract also allows them to take money out of your account at any time for any reason. So it's a really heavy-handed, abusive, large company contract versus a small doctor's office. And so we had one company take over $1 million out of our account, our bank account. So what's going on? So, well, we're looking for fraud. We said, well, what's the fraud? Oh, we don't know. Well, why did you take over $1 million out of the account? Well, we just think it might be significant, so we did that. So it didn't put us out of business, but a lot of small businesses taking over $1 million out of your account would put them out of business. Making payroll and rent and insurance, paying insurance on the building, all the things you might not be able to afford. So they did that. We went through all the audit with them, and the end result was that they had overpaid us several times for patient visits of claims that we filed, like normal stuff, but they overpaid us by $20,000, $30,000 roughly. And so they collected that back and gave us the rest of the over $1 million that they took from us back. But it took, gosh, almost a year to fight for the
wow.
money that was not theirs.
So over a year of
Almost a year, almost a year.
missing $1 million
Yeah,
of your account.
yeah. so so at that point, um, Dr. Bo, who owned the clinics, and we were growing them, and he said, "I'm done with insurance. Sell them." It did take a few years to do that. If you go to sell a business and you have to sell it tomorrow, that's not the best price or the best scenario. If you have a few
Hmm.
years, you can structure your business and you know, make sure it looks proper and everything's fit for a buyer. And
Hmm.
so we did that. We took several years to do that. In late 18, December of 18, 2018, we sold the HealthFirst clinics to a group that was venture capital backed out of Nashville, Tennessee. That's where 300 healthcare companies live,
Hmm.
and a lot of the money that finances that. So they bought the clinics and wanted me as the outgoing CEO to stay on for a year with a 1 year non compete at the same time. And you know, the end result is I had told them before we did the transaction that I would be creating Holy City Med in Charleston, doing urgent primary care, not filing insurance claims, but doing all direct pay right here in town. And their attorneys came back and said, okay, so we're doing exactly what we said we would do 5.5 years ago, and waited that year. And then 4.5 years ago, started Holy City Med to offer almost the same, very similar services that we did, although we've added same day mental behavioral health to our other same day primary care and the other same day services um, that we did before at Health First, but without having all that expense of the insurance filings and claims and collections and contracting and registering all of your doctors for insurance contracts that is very costly.
So you go through all this stuff with Health First. I mean, that's a massive deal to go through. I can't imagine waking up tomorrow finding $1 million out of my account. I can't even express the level of anger I would feel at that point. Um, so after going through all that, having to navigate an exit from Health First, what why did you want to relaunch? Like, why did you want to stay in the space and go through the process of opening up a clinic and everything all over again?
Well, we were two reasons. I mean, we were making a fundamental change in the way we got paid. So no longer getting paid, having to worry about jumping all the hoops and hurdles to get paid by the authority of the insurance company. Really getting paid, you got to ask the patient for the money. Insurance company is not paying that, but they're telling you how much you can charge. It's like buying a car and them telling you, we have no idea what the price is, but in 30 days, someone's going to send you a bill from the car company, and that's what you pay. In my consulting business, where I worked in 14 different industries, no one else did it that way, and neither should healthcare. And so we don't. So we use the same services and the same efficiency model of not having the doctors be data entry specialists, letting them just be doctors, hiring scribes to be the data entry specialists for the doctors, and make a very efficient process for the patients to get in, get seen, get their treatment, get their care, and go back to work or go back home and be with their family. So we took that and we just eliminated the hurdles, all the hurdles involved with the insurance process. Now, people can still take their statement, their walkout statement from the clinic, their visit summary, and file it to the insurance company and see if they get paid any money. But typically, because of what happened in 2014, they no longer get paid by the insurance company until they've met a deductible. And again, usually they're only going to meet a deductible if they're in the hospital or have some sort of major surgery or awful illness that's going to last a long time, a cancer type diagnosis and such. So yeah, we took the good and we left the bad.
So, would you say that that's probably? I mean, would you say it's probably the biggest challenge that you had at Health First that you learned the lessons from and then applied to starting Holy City Med, or was there other stuff from a leadership perspective that really helped kind of kick off Holy City Med and make it into a quickly thriving business?
Yeah, having to accept and file and get paid through what the insurance company tells you you can then charge the patient was absolutely the biggest challenge. I mean, think about it. In the example of a car, if you had a third party involved in a car purchase, and every car purchase around the world, it would be terribly disruptive, and um, it would not be transparent in price.
You take the lessons learned from HealthFirst and adopt a new model, eliminating the insurance factors of HealthFirst and Giant Medical, and essentially create a similarly efficient but a better model in terms of billing structure and staffing. Um, Whenever you launched Holy City, was it like you like had these lessons, you put these things in place, you kicked the ground running, and it was just like smooth sailing? Because you're only 4 years at this now, and you've got two locations, and you are super successful in terms of revenue bringing in and patients bringing in, brand awareness, etc. So, like, did you guys just hit the ground running and just smooth sailing from there? Or?
So we did. So we were celebrating what was it, PRs, great results almost every day. We might, hey, let's have a beer or something, let's celebrate. And so we're pretty much doing that every day. I mean, gosh, I can't remember. We opened January 9th, 2020, like 2.5 months before COVID. Um, had our first, I don't know, 9 or 10 or 12, 14 members that signed up the first day. I forget it was, um, I forget all the numbers, but maybe 25, 30 patients the first day, which is great. People don't even know you're open. So, and then that first 2.5 months, we were trending up every single day. Um, and then COVID hit. And then the recommendation was, don't go anywhere, stay home, don't go into any places in the inside. Of course, we, invested a lot of money on the inside of the clinics. Um, we got a phone call from an ER doc who was running the Roper ER and to do testing, do COVID testing. So while we're not doing it, we're sending them to musc.care to enroll and sign up for all the testing, basically across the street from us at Citadel Mall. And what this ER doctor told us is, well, they won't test if they don't have symptoms. And all of my nursing staff has been sent home because they were possibly exposed to someone with COVID with no symptoms at all, and they can't come back for 14 days. He said, I cannot run my ER at Roper without my staff. So 2 days later, we started doing COVID testing, where we thought we would always just send them across the street. The self-pay price for MUSC was $320. It was over $300 for people to drive up if they had symptoms to get a test. Uh, we decided to do it for $80. It was a little bit of a lost leader, but we said, hey, it'll be a couple weeks. This is what they told us in the beginning. We'll shut down for 2 weeks. We'll be fine. We'll be back. That's not what happened. But so we were charging $80, 1/4 of the price of what the large entity across the street from us was charging, and helping people really know whether they were positive for COVID or get their negative test so they could go back to work. They could go take care of other people. In that case, work in the ER and take care of people that really needed their help. So we loved being in that position to be able to help because we weren't really making money out of that. We were handing out purple postcards to everyone that came in the drive-through and said, "Hey, by the way, we have clinics. So when this all clears up, please let us care for you and your family and your employees." And so we thought of kind of as a marketing thing, not to be able to make money that. And then we're 8 months in. It's the end of 2020, and we're 8.5 months in. We did increase the price by $20 per test because, we need to make a lot of money and cover some expenses and other expenses with this COVID testing thing. One of the news stations thought we were price gouging. We said, no, look across the street. They're 4 times higher than us. We're not. We just don't want to lose money by doing this. And then we started going on site. I mean, even that summer after COVID, we started doing on site testing. So two things already we've created is a drive-through for medical. That sounds weird. Drive-through, you can't do that. Well, we did. And then a lot of on-site type stuff for larger companies. I mean, Denton Shipyard had called us on a Thursday afternoon and said, "Can you guys do on-site testing? We have hundreds and hundreds of employees potentially exposed. We don't know who's has COVID and doesn't have COVID. Can you come on site and do that?" And we said, "Yes." When? And they said, "Tomorrow." So on Friday, the first day, the day after we decided to do on-site testing, we did 540, 550 on-site tests for Denton Shipyard, and we're able to help their employees and Dentons know, who was positive with COVID and who was negative, and who can stay and work, and who had to go home. And so then we started doing on-site testing for many companies, and even Santee Cooper, all their locations around the state. So all of that, where we were growing fine before, growing our membership, growing our volume, our walk-in, everyone loved the pricing and the access and the affordability of our care and the efficiency, um, and the fact that the quality too. I haven't even mentioned quality. So we took the same quality we had at Health First and brought it to Holy City Med in our provider team, which is mostly MDs, DOs, and PAs, where all of them have a specialty in primary care. I can see you today for your primary care issues. We've added mental behavioral health, and all of them have had experience in the ER. So in the ER, you see people with chronic conditions at their worst, and you treat them that way. So if someone comes into us, we can find them very quickly that they might need a 911 call from our clinic to go to the hospital to get care, whether they're having a heart attack or there's other issues going on. And all these doctors and PAs are so calm because they've worked in the ER where there's craziness going on and a little bit of chaos. And for them, it's, oh yeah, let's get an IV on that person. Let's pull their information, get it ready. We call 911. They'll be here in 6 minutes, 5 minutes, and get them all ready and keep all the staff calm. What you see on television in the ER is not what you see in a normal ER or in our clinics because of their training. So again, they're specialists in primary care, but they've worked in the ER, so they can do all the laceration repairs at these companies. If somebody cuts themselves or they need X-rays or all those things they can do because of their training, and we just love that. To have an efficient model to let them do what they were trained to do and use the experience they had in a really high acuity scenario, acute care, to use within our clinic. That's just unlimited, come in anytime you want.
That makes sense. So let's go back and kind of focus in a little bit on that exit strategy and your transition. Um, so as you're having to go through planning and preparing and negotiating the sale of Health First, what are some of the lessons that you learned through that process that you incorporated into Holy City Med that has helped it achieve a faster growth and will help you down the road?
Yeah. So I've titled a book I haven't written yet called How to Sell Your Business in 3 to 5 years at the Best Price. So it took a few years to go through the process of selling, structuring the company, making sure you have your expenses lined up well, you have growth trends, and looking at the appetite for investor dollars for your specific industry and then your niche within that industry. For us, urgent and primary care and weight loss and occupational medicine. So knowing that and being able to be prepared and gather a whole bunch of information for that, go through the due diligence period, you're ready in 3 to 5 years, not in 3 to 5 months. Companies that sell in 3 to 5 months usually have other issues, and they're probably not going to get the best price. So that's a possible book that I may write. It really doesn't affect how we're growing Holy City Med, because the idea is not to grow it to sell, not to grow it to exit. It is to grow it to continue to use the additional cash flow and the excess profits to grow more clinics. So the goal is 62 clinics in South Carolina, taking care of all the major cities and some mid-tier cities, so that people and employees that work for an employer have same day access. Say you were Boeing and you had 8,000 employees and you need a full clinic on site. We're that for smaller companies. Now, we can also build them for employer groups that have 2,000 or more employees around the state or almost anywhere. And for free, build them a clinic. And then the subscription model, the monthly subscription model, covers everything.
And so, as you're looking at that goal of 62 clinics, you're currently at two, which is one more than one.
We're only short 60 clinics. We're so close.
And that's, the crazy thing is that even though you're far from that goal, you're also much further than most business owners ever get to. Because getting to the point that you have more than one location that's able to be properly managed without you in there day to day is a feat. It's a big challenge for business owners. So, what are some of the things that you have utilized that has assisted with ensuring that you've transitioned, that as you've had that second clinic, that it's doing things the same way and achieving profitability and success, just like the first clinic, which I know in addition, you're also typically not at the clinic all the time because you're out networking and being in front of the public. So, what are some of the tools and lessons that you've utilized to help that to happen?
Yes. Finding great people. I mean, that's so my greatest blessing, joy has been to find great people. So, um, uh, regardless of what the title is, you might refer to it as chief of staff. So, whether it's COO or head of HR or something like that, but chief of staff, the person that knows the people there, that's involved in the hiring, whether they do it or not, involved in the operations, the day to day, and involved maybe in some other things at the same time. I have that in Chelsea Morel. I mean, she's amazing. We worked together at HealthFirst. She stayed on to HealthFirst for a while, but in the transition with the new group, they changed 33 different processes in the first several months, um, from a very efficient, very awesome care model to a whole bunch of stuff that you see in other clinics and hospitals all across the country, just to make it less efficient and less effective and more costly. So she became very frustrated with those changes that they had and said, "Hey, what are you doing?" And I said, "Well, I can't solicit anybody, but you called me, right?" I told her 12 times, "Yeah, I called you. I just called you. I'm asking you what you're going to do." And I had to be very careful because I couldn't solicit. But I could certainly, if someone called me, I could tell them about it. And she was like, "I want to do that. I want to do direct pay. I don't, this is crazy. They're changing the old health first that we had into something different." And they have, and it's their right to do that. They own it. But she wanted to do something that was more serving, just taking care of people without all the craziness and all the changes. So finding a great chief of staff and then a great team that wants to care for people. And part of that is your could be your incentive structure, your pay structure. I mean, even times when I was putting money into the business to make the gap in payroll, I'm also writing a book called Making Payroll, The Business Owner's Journey. I have notes for that one too. But even when I was doing that, we were still feeding all of our staff, which is thousands of dollars a month to feed, 20, 30, 40 people every day lunch when they worked. And so just making that commitment and investing in them, I didn't lose any money during that time period. All that money was invested in others. So just great people. And they weren't working in an environment that was just so slowed down and weighted and burdened by this insurance process that makes everything harder. We just made it easier. We made it easier for our staff and for the patients. I mean, imagine a model that changes things and makes it easier and less expensive and higher quality and faster.
I mean, from a from somebody that has been in the ER and in medical buildings plenty, not for my own doing, but for being there with others. Um, yeah, that process is terrible. So to think about the what you've created with that access, I mean, the biggest thing that I dread, right, is like, man, I don't want to go sit there for 2 hours. I don't have time for this. So just eliminating that, it hopefully gets more people into the doctor. And of course, everybody knows that if you can get to the issue sooner, you're more likely to get it corrected, and for it to be less expensive to do so. So that makes a ton of sense to me. Um,
So I will say one of my favorite billboards is prevention saves lives. So the earlier we can help somebody get that care, get that diagnosis, the better off they're going to be. And our hope is they don't have to go to that expensive place to get that higher level of care. We can catch it early.
so you're now 4.5 years in,
Yes.
with a multi-million dollar business that also has high expenses that have to run it too, right? You've got staffing and air conditioning and rent and or leasing costs and everything else. So, what are some of the things that you would attribute the most, outside of people? Because you know that's probably the top one. So, what would you say is maybe the second and third largest factors that have contributed to such a quick growth? Right, there's so many business owners that will never even see seven figures, much less multiple seven figures in revenue. So, what would you attribute, some other lessons learned that have helped that to happen, especially so quickly?
Yeah. That's an interesting question. So, in my brain, so as a founder owner, you always think you're going to grow more quickly than everyone else. And so our goals have been much faster. I'm going to change the question a little bit. So the challenge has still been educating people that they can go to a direct pay model even with insurance. Most people say, "Well, I have insurance. I'm just going to use that." You go, "Well, all right. Your visit's going to be $250 to $350. If you walk into our clinic, it's $100. Or if you're a member, all your visits are free, and that's well under $100 per month for unlimited stuff." So, educating people. I mean, yes, we've been successful. Yes, we're making money and we're covering all expenses and being profitable. Um, but we're not nearly at the growth rate that I expected, mostly because of the instability of the last 4.5 years. 2.5 months in, there's COVID, there's shutdown, there's 42 million people being told that their job's not essential and they can't work. A large, significant portion of our workforce, right? And still 60% of people work for a small business. And so having that during this time of great instability, nonetheless, we've still grown and been successful. So I believe there's even a larger growth rate for us and, multiplying ourselves in not only throughout Charleston, Charleston metro area, the low country, but also throughout the state, that gets us to that 62 way more quickly than we got to two. Um, because hoping that we get a period of instability where small business owners can say, "Hey, I can invest in that. I can grow that. I can hire people." Um, uh, Getting back to stability of economic forecasting and looking to the future would be explosive. Explosive growth for us because now you've got people that can plan. When there's instability, you don't plan, you contract, and you just hold on to what you have. So yes, thank you. We've had great success, but I think there's more for us in the future when there is stability in our country.
So, would you say that? So, looking at that stability and trying to achieve some of those goals, what are some things that are within your control, and what are you doing to influence them to overcome that instability, to push the business forward?
Yeah, education. It's really an education piece. Like I said, letting people know that your $3,000 deductible or higher is a great fit for our unlimited everything else plan. We do 90+% in our clinics of why people go to the doctor. And, the 1, 2, 3% happens at the hospital, right? The gap maybe between that might be specialty care. Uncontrolled diabetes goes to endocrinology and such. So, and we have a great network of 28 different specialists here in Charleston that take care of our folks and have self-pay discounts. And you don't always have to use your insurance plan to pay for that, and you can save more money. Being able to offer that to people and educate them in the sense that if you have insurance, it doesn't work the way it worked before 2014. It works differently. You Most plans don't get coverage until they hit their deductible, and most people never hit their deductible. So we just sit in that gap in that area where people are mostly get overcharged for medical services. I mean, we tell them all the time: ask anywhere you go before you pull your insurance card out. Ask for the self pay rate. Once you pull your insurance card out, that doctor's clinic has most likely signed a contract that no longer allows them to give any discounts. They now must use the pricing fee schedule from the insurance company of the card you just showed them by contract, or the insurance company will come and take money away from that doctor's office because you gave a discount. So we tell people all the time that's a hack. Ask for the self pay price on a CT on my knee for $210 instead of 900 through the insurance. MRI is
Wow.
the same, all imaging. There's a list of services, even surgeries, minor surgeries you can have. If you say, what's the self-pay price? No, it's $3,000. So what's the insurance? 15,000. Why? So
That's crazy.
yeah,
That's
very fun.
wild. Can you discuss a moment of triumph or success that you've had at Holy City in the last 4 years that stands out in your mind?
I'd say Gerald's Tires. So Gerald's Tires signed up with us early on. That they're 50 years old. They're actually speaking tomorrow at an event at Wachiba, but they are so specific and such good stewards of resources that them adding us to their employee plan was huge. And everyone knows Gerald's in the Bright Orange building, and Bill Watts, the owner, has said, he says, Frank, it's the greatest thing because now my employees have a relationship with a doctor, even if not. It doesn't have to mean that something bad is going on. We do a ton of preventive care, and their high blood pressure and cholesterol and weight issues and stuff are all being taken care of by us. They get in and out in a half hour, 40 minutes. They now go to the doctor because no longer do they feel disrespected by the doctor. If you go and have a 2 o'clock appointment and don't see the doctor till 3:30, you don't feel respected. And people won't go to a place if they don't feel respected. They'll stop going. And how can you do preventive care if you're not going? So the efficiency is not just about getting people in and out and utilizing the facility more and more profit, although it can be. It's really about the patient, getting them in and out, getting their care and con. We do video visits. Right before COVID, there was very tiny adoption for video visits. People say, "Oh, you do telemed?" No, we do video visits. You can see the doctor can see you. That is way better than just listening to the patient on a phone call. And so, that is totally free for all of our members. And so they can connect with their doctor who they've seen a few times, say, hey, I forgot my medicine. I'm in Ohio. I need more of this. I'm diabetic. And great. Where's the pharmacy? I'll call it in. So boom, boom, boom. Being able to help people and get them care super quickly is just, I mean, it is so much fun. It's like getting your tires rotated at Gerald's. So that was a big win for us to have them, and to this day still have them. And um, you know, it's great to see their employees come in. I know a lot of them because I've been going there for years too.
That's awesome. So, looking ahead, what are one or two future goals that you have for Holy City Med, and what are some of the past lessons learned that will help you that you'll be able to leverage to accomplish those future goals?
Yeah. So probably two things. So I mentioned the 62 clinics for South Carolina. The goal outside of the state is to have it funded by venture capital or some private equity money to help us grow outside of the state. We'll maintain local ownership and operations for the South Carolina ones and let them help us grow for other states, which would be kind of cool to have a financial partner at that point. Probably grow a lot more quickly. Um, and then the other thing is to allow the new members that join us to fund the next clinics. So that's the idea. I funded the first two clinics, and a little scary when you invest a couple $1 million per clinic and get them up and running, and then there's ongoing costs, payroll and rent and all the things. But to be able to, because we are so efficient, we have capacity that's not yet filled. That when those new memberships come in and those companies take care of their employees, they're then investing in the next clinics, and that will start to kind of snowball on itself. When you have four, five, six clinics adding new members that don't have to bear the cost of that clinic, but can bear the cost of the new clinics. Now you've got sort of a cycle that says, "Oh, I can build six more this year. Oh, I can build 12 next year." And so that's the idea of the picking up the pace on the growth with members that are extra, I guess, extra revenue for us to be able to then go build. It's not extra revenue for me to put in my pocket. It's extra revenue to go build more clinics, help more employers and employee groups and their families. I mean, our plan is so great for the employees, but it also, even for less than $2 a day, you're the people that live under your roof, whether they're boyfriend, girlfriend, spouse, kids, aunt, uncle, they can be covered under our membership for even less, because we know that that expense is on the employee, not the employer, and so we dropped the cost.
That's incredible. So as we wrap up today's episode, thank you so much for coming in, Frank, and giving us some incredible insights. Definitely looking forward to hopefully having some of our members take some of this information, understand that the way that they're operating in their status quo does not have to be the way of the future, even if it's in the insurance and health industry, which is one of the most regulated and difficult industries to operate in. At any point, you can be an industry disruptor.
Yeah.
So, as we wrap up today's episode, remember that in the face of adversity, there is always the potential for growth, resilience, and success. Make sure to join us next time to continue exploring inspiring stories of overcoming challenges and thriving in the journey of life. This is Alan signing off from Evolving Waves.